One of the two ways of performing lung volume reduction is the insertion of one-way valves, what we call endobronchial valves. These are small devices made of silicon and a metal called nitinol that we deploy into the airways of the most destroyed bits of lung. These valves allow air out of the lung but not back in, and therefore the area that the valves are in deflates over time, and that causes a reduction in the overall volume of the lungs and leads to improved breathing mechanics. When you are admitted for your endobronchial valve procedure, you will be seen by a doctor who will check you over and make sure that you're well enough for the procedure. You'll then go to the endoscopy unit for the procedure, which typically takes an hour. After that, we will admit you to a ward in the hospital, and we keep you for 3 nights afterwards to monitor for any complications and to make sure that you're well. Most patients who have endobronchial valves have no immediate problems while they're in hospital. However, as with any procedure, there are potential complications. The main one for endobronchial valves is something called a pneumothorax. A pneumothorax is where you get air between the lung and the chest wall, and it impairs the function of the lung. When you put valves in a section of lung and it deflates, the rest of the lung tries to expand to fill the space left by that deflated lung. And because the lungs are a little bit like tissue paper when you've got emphysema, it's very easy to tear the lining of the lung. Air then escapes from the lung out into the chest cavity, and that usually requires what's called an intercostal drain or chest drain to be inserted between the ribs to allow the air to come out. This happens in about 25 to 30% of cases and can delay your hospital discharge. Patients are also likely to cough up a little bit of blood for a day or so afterwards, which is entirely normal and not something to be worried about. And there is a small risk of infection or COPD exacerbation after the procedure, simply because we've been in your airways.